I said, empty your mind. Be formless, shapeless, like water.
It's about how hard you hit. It's about how hard you can get hit and keep moving forward. How much you can take and keep moving forward.
Join movement expert Aaron Alexander as he dives into the minds of the foremost innovative healthcare thinkers on their approach to optimal health and wellness. Align Podcast.
Welcome back to Align Podcast. My name is Aaron Alexander, and today's gorgeous episode got to have one of my preferred human beings in the world, Dr. Stuart McGill. I've been following along with his work for the last 15 years, I would say, is the beginning of me digging into his stuff. And he's the world's leading expert on all things spinal mechanics, you could say. We've had him on, I don't know how many times, 3 or 4 times, and I value him greatly. I know you guys are going to get a lot from this episode. We get into, generally, spinal hygiene, I think, is a good term that's kind of like a synopsis for the whole thing. And so yeah, how to take care of your spine, how movement affects your physiology, how it affects the development of your bones, of your muscles, of your connective tissue. And it's just such a valuable conversation. I hope you guys dig it. Thank you so much for tuning in to the website, alignpodcast.com, ALIGN podcast.com. And on there, you guys start the 5-Day Moon Challenge. People have been really digging that. I'm so grateful that people love that. It's 5 simple videos, breaks down fundamentals of what everybody ought to have in their daily existence to move well for the rest of your life. So jump on there, alignpodcast.com, and you can get started. Real simple. Wanted to give a shout out for folks leaving reviews on iTunes. That's the way the algorithmic gods have a sense that this podcast exists, and it's how it grows, so I greatly appreciate that. This is from Kelsey and Jade. All I could ask for is more! Exclamation point, multiple exclamation points. Aaron has created a down-to-earth style of interviewing that is raw, full of quality content, and guides discussions so viewers can learn, be entertained, and feel like they're actually sitting in a sauna with good friends. And then they go on to say more great things. So thank you so much for that, Kelsey and Jade. Hit me up at Align Podcast or Align Band on Instagram, and we'll send you some stuff out from our show sponsor, Four Sigmatic. I've been using Four Sigmatic for the last 2 years, over 2 years, I think. And they're awesome. Really high quality medicinal mushrooms in the forms of reishi and cordyceps and shiitake and lion's mane and all the ones that you need. I use the reishi pretty much every night, not 100% of the time, but a really high percent of the time before bed, for rest, down regulation, calming your nervous system. Really great stuff. Cordyceps, I use those guys before I go to the gym or do some like movement stuff, and they're great. They've been helping me out for a long time, and I appreciate them. And you can get a discount if you go to foursigmatic.com/align, FOUR Sigmatic, SIGMATIC.com/align, and they'll hook you up. Hope you guys dig that stuff, and I know you're gonna like it. I think we're good. This conversation, like I said, he's world's leading expert on all things spine. So this is really cool opportunity for us to get to learn from this guy. And I just so greatly appreciate you guys tuning in. And here we go. Back to the Shizal with Dr. Stuart McGill. Pow.
Align Podcast.
You've mentioned degenerative disc disease as being that. I think we think of sometimes these things as being something like that happens to us, and it's like a parasite that's like sucking from us, you know, our life force, as opposed to something that we're continually doing to ourselves. Is that something that, can we talk about that a little bit? Like degenerative disc disease, like what?
Well, certainly I think it as a disease, it's extremely rare, and worse yet, when a person is told that by their family doctor reading a radiology report, or a radiologist even writes that in a report, it's awful. The patients show up here saying, "Oh, Professor McGill, I've got a degenerative disease. I've got degenerative disc disease." And I look at them, I do an assessment, I view the scans, and I realize, no, they have something very, very specific. It's not disc disease at all. And what a horrible game to play with a person, allowing them to believe they have a degenerative disease. Most of the things that radiologists ascribe this very garbage term to are very specific, and most of them will gristle up over time and not be symptomatic. So there's the start of it. And usually it's just their inability to really see the details that are there for a trained eye to see, and they see a flattened disc, or at least a disc that's lost some water content and some height. And they just say, oh, well, it's a disc disease. No, it isn't. If you know how to interpret the scans, you'll see the precise mechanism that led to that.
Yeah. So a huge part of the book is how we can shift our environment in such a way that forms our bodies in a healthier direction each day. So
is this really about adaptation? So adapting tissue, adapting our bodies? Is that the key word here?
That's what it's about, I think.
Fabulous. Oh, I've got so many thoughts.
So that's the interesting thing, is like, that's like, the kind of the bane of our existence, but it's also like our value is that we can adapt to anything. So no matter how degenerative the environment is or how robust the environment is, we'll adapt to it. So is there anything that you see stand out, low-hanging fruit that we could shift in our environment?
Well, absolutely. Have you seen the recent book I did, co-authored with Brian Carroll, called The Gift of Injury?
Yeah, I read it a couple times.
Okay, so you saw the MRI scans of when Brian first showed up at our clinic.
Yeah.
At the university. His sacrum was split front to back, very heavy fracture. His L5 was crumbled at the front. The disc above and below were far beyond degeneration. They're extremely damaged. And then we show the MRI 3 years later. And we realized at the beginning, through assessment and looking at the images, we knew that he would not be able to get out of pain. And as a powerlifter, a champion powerlifter, remember that this fella had squatted 1,100 pounds 50 times in competition. So we knew that he would never lift or bear load again until we adapted that tissue. And if this is what it's all about, yes, we had to adapt that tissue to bear load again. Well, you know how we worked. We keep working at a problem until we can converge on a solution. So the first thing I did was I took a cadaver, I loaded it under very heavy load, and we created exactly the same fracture in the sacral plateau. I then took bone cement, PMMA, or polymethyl methacrylate, which is what an orthopedic surgeon would do. In some cases, it's called kyphoplasty. You inject this bone cement into say an osteoporotic vertebra that's collapsed, or one that's had a burst fracture, or something fairly damaged with load. But what was interesting, I couldn't seal off the end plate where the disc at the top of the sacrum, and it has to contain nuclear pressure in the disc. Otherwise, it will fail again. So, and I tried to develop artificial nucleus in my years as a professor, did different polymers and that kind of thing. But the failure to create this artificial adaptation was always in the inability to seal off the end plate. So I said to Brian, I don't think a surgeon is going to fix you. And there was no surgeon that was really willing to do much for him except fuse him up. But I don't think that would have done much with such big fractures either. So we did what we called bone callousing. And I'm going to talk about how we understand body adaptation from a general principle in just a minute, but let me finish Brian's story. Yeah. You're aware that if you fracture a long bone, your body forms a callus over the fracture, and when it calluses up, it's actually stronger than the unbroken bone on the other side of the body. So bone callusing is directed by what's called Wolff's Law, which is the adaptation law of bone. So if you took a long bone and you bent it, the outside surface of the bend in tension, and then the inside curve of the bending bone is in compression. Well, bone is a piezoelectric material. Were you ever a kid and you had two pieces of quartz and you would go out at night, say at summer camp, and you'd rub the two pieces of quartz together and flashes of light would go through the quartz? Do you know what I'm talking about?
Yeah, I know exactly what you're talking about.
Okay. So a quartz is a very powerful piezoelectric crystal, which is when you stress it, it builds an electric charge. Well, bone is a piezoelectric material. So when you stress bone, it builds an electric charge at the location of highest stress. So that's the magic of how your body knows where to adapt bone. It lays down bone where it needs it at the point of highest stress, and it takes it away from places of lower stress. So I knew that was really the only biological adaptation principle we had with Brian. So we organized a bone callousing program where he exposed his spine to very modest loads. And I'm talking, like a suitcase carry of a short distance or something like that. But then you take 5 days off, because if you only take 2 or 3 days off and you stress again, the charge that suck in free ions that build bone, the free ions of calcium and magnesium, they get attracted to the piezoelectric charge and they scaffold on with a chemical bond. But the problem is you've got to let them scaffold on and stay for 5 days or so the scaffolding becomes robust. Otherwise, the next time you move or load, they break off again. So that's what he did. And I said, you're going to have to do this for several months, even when you're out of pain. So when you understand the mechanism of adaptation, it helps your training and know that you've got to keep doing this long after you're out of pain, because you still have to build that robust bone back again. So basically he focused on that for about a year. He cheated on me, not quite a year. And then the second year he worked on getting his athleticism back. Well, he squatted 1174 last weekend. Wow. Which is so difficult to get your head around if you haven't been in the same room as someone under that kind of load. But my point was, there's a story of adaptation. If we did a normal back pain intervention on him, it would have failed. We had to understand the mechanism with precision, so we knew how to organize the adaptation. But it's so interesting when I get bodybuilders, for example, who want to become strength athletes. Well, they've trained themselves to hypertrophy muscle, which basically you take a day off to let the muscle rebuild and grow, and then you do it again another 2 days later, etc. But when they start training true strength, where they're really starting to load their vertebra and the cartilaginous end plates, etc., a lot of them get into trouble with cumulative trauma because they're training without enough adaptation time. Whereas if you look at a true strength athlete or a power lifter, typically they might do heavy squats and then take 5 days off. In other words, their training regimen is naturally a bone callousing adaptation program, which is different from an Olympic lifter. Which their volume of training is much, much lower than certainly a bodybuilder and certainly the strong men and powerlifters, etc. Yeah. Anyway, there's a little bit of a start on understanding the tissue that needs adapting, and then what tools do you have in your toolbox to stimulate optimal adaptation and increase your risk of decrease your risk of failing.
Yeah. So seems to me almost like this piezoelectric effect. It's almost like an electrical wand, or it's like we're sculpting ourselves every time we make contact with anything. So right now it's like, okay, well, I'm not an Olympic lifter, I'm not a bodybuilder, so I guess I don't, do the piezoelectric thing. But like right now, literally, as you're sitting down listening to this, like right now I'm in a 90-90 position with my legs. So just the pressure of my sit bones and my hips on the ground and the stacking of my spine, I'm sending that current through my whole system, sculpting myself as we're having this conversation, right?
Well, you may or you may not. Bone, very much so. But there are, now what we're talking about now is mechanostimulation, which stimulates different adaptation processes. So when you stimulate, say, fascia and load it, or ligaments and tendons and those kinds of things, or think of skin, the collagen fibers of skin are random. Well, they're not random. They're all over the place. In other words, the weave of the fibers. Do you know the difference between a fiberglass cloth and a fiberglass mat if you're a boat builder?
I do.
Yes. So the fiberglass cloth has fibers that run north and south and weave.
Right.
Mat, they're random. They're all over the place. They're just laid down. You know what I mean?
I do, yeah.
Yeah, good. You and I could have fun together. You know a lot of basic things. So
that's all I know. I think it's basic.
Yeah, but skin has the weave of collagen like fiberglass mat, whereas tendons have the collagen aligned only north and south with just a very loose structure, so they can fray apart if they are run over the edge of a bone or a bony pulley or something like that.
Right.
But again, if you understand what the adaptation is there, it may not be quite as electric as bone. In other words, it might be a chemical instigator to the adaptation, but the root of it all is mechanostimulation.
But that mechanostimulation, we're continually forming ourselves.
Yes.
Right. Throughout the day, 100% of the time, we always have these osteoclasts or osteoblasts or fibroclast blasts. They're always building and chewing away the old stuff, building the new stuff, chewing away the old stuff.
Exactly.
And so that's kind of like, to me, that's a really interesting big idea that I don't think a lot of people recognize, because we isolate our movement, our conscious movement, to the yoga studio, martial arts, or gym, and then the rest of the day we just forget about it. So what I'm really interested in is kind of what I conceive as the reality that we're always doing fitness. We're always constructing ourselves.
Thank you.
Is there something to that?
Yeah, we call that spine hygiene.
Yes.
So we in certain there's two people where that's really, really important. The people in the middle, it doesn't matter to them because the demand of their life is they have enough capacity in their body to meet the demands of their life, but their life is not really that interesting. There's no big demands on it. But let's take an athlete who is a speed, power, strength athlete. They have huge demands put on their body because of the demand of the sport. So their body has to have a very high capacity in terms of load bearing and these kinds of things. Now let's think of the poor back pained patient or anyone with pain and loading compromise at the other end. They don't have a margin of safety, just like an athlete doesn't. Their capacity is very much lower. So they can't take much more demand. They always have to have more capacity than is demanded of them, otherwise they get injured. But you see, with athletes, they have a huge demand, so their capacity has to be even bigger. But people in the middle, you know, they don't. I mean, I'm glad my life isn't like that. I'd be bored to tears.
Yeah.
But so there you go. It that same principle matters at both ends of the spectrum, and then the back pain person and the athlete has to build their capacity to train by performing spine hygiene all day long. Look after their back so they have some capacity left to make sure they're over and above whatever the demand is. And their demand might be simply sitting at the computer for 20 minutes and then dragging their garbage bin down the driveway for the pickup. You know, that's their demand, but they're so close.
Yeah.
That's their capacity, pardon me, but they're so close to their demand and breaking into pain. But for the average person, they have a lot more capacity in their body than is ever demanded with their boring life, and they don't pay the price for it.
Are you familiar with Joan Vernikos?
No.
Oh man, you'd get a kick out of her. So she was I believe she was the director of, I think, like life sciences or something like that at NASA. She's got a couple books. One is called Sitting Kills, Moving Heals. She's got a new one out as well that I have sitting over here. I forget what it's called. I haven't read the next one yet. But her whole thing is studying astronauts and people in general outside of gravity. And she relates astronauts and they go and they lose that force of gravity, their body ends up going haywire. And she relates the closest thing we have to that here on Earth would be like water. But as far as studying people, water weirds them out too much. You can't have somebody in water for 10 days, but you can have somebody just lay on a bed for 10 days. And they actually did that with people. And what they see is they see really similar effects of all the deleterious effect of being up in space happens when you just lay on your back and you get outside of that stimulus of gravity, you needing to stack your bones continually throughout the day. And so what she talks to about there is the value of like continuous low intensity work as opposed to sedentary lifestyle and then a blowout CrossFit class once a day. And
I'm very familiar with the work, actually. I've consulted for both NASA and the European Space Agency and whatnot on these various questions. So you're absolutely right. I have great sympathy, but you might find a little bit of a nuance that, do you remember when Glasnost happened and Gorbachev took down the Iron Wall around the Soviet Union?
Yeah. I mean,
just at that time, you've heard about it. Just at that time, there was a meeting of spine scientists in Warsaw, Poland. And I was invited with another Canadian as the Canadian delegates, and they had various European delegates brought in. And we saw for the first time the cosmonaut science. Now, the Americans are astronauts, the Soviets are cosmonauts. You would think that the spine loses mineral mass when you go into space because it's not loaded. Well, actually, all the bones of your body lose mineral mass when you go into space, except for two. One is your skull, and one are your vertebra in your spine. And here's the mechanism. Your face, you get puffy face syndrome when you go into zero gravity in space because your lymphatic system are always milking your body fluids back against 1g gravity. So they're used to pushing it uphill. As soon as you go out of gravity, they keep on milking fluids up towards your head and you get a fat head. And your brain swells and goes under pressure. And it's actually sufficient to stimulate bone growth in your skull. But the other one is we put students to bed for 2 days, was it? 36, I think it was either 36 or 42 hours. And we measured how their spines grew. Now, we knew from the cosmonaut program that some of the cosmonauts grew almost a couple of inches their first 24 hours in space because the discs are hydrophilic. And they keep sucking up fluid. So when you go to, let's just take that as part of the start. When we measured these students going to bed, your spine is a bit shrunken when you go to bed. You're actually shorter at the end of the day because hydrostatic pressures are squeezing fluid out of your discs all day long. But then when you go to bed, the fluids get sucked up in your discs, and in the morning, you're actually taller. Well, as it turns out, that equilibrium stress level comes back after 8 hours in bed. And this was our contribution to it. If you stay in bed longer, your spine keeps on growing, just like if you were in weightlessness. And then the discs become so full of water, they put your spine under stress, sufficient to build bone. Wow. So isn't that interesting? It's opposite. But the cosmonauts and astronauts, many of them are on painkillers for spine pain when they're in space. A lot of people don't know that. So yeah, your body does go haywire, to use your words, when they're in weightlessness. But there's a little bit more interest to the science. And if people think, I listened to an interview with Elon Musk a little while ago, and the guy who runs Amazon, Bezos. Oh, we're going to move to another planet. Don't you believe it? Our bodies are so tuned to 9.8 meters per second squared G-force. It's unbelievable. Your eyes are going to go funny. As you know, astronauts have so many eye problems later in their life because of that time in space with the pressure in their eyeballs. Your body is so tuned. You can't live at 0.6 gravity like on Mars or something like that. It's your body, it just won't adapt to that extremeness.
Yeah. One of the interesting things that Joan Vernikos gets into in that book is she says that this the experience in space, it almost seems as though it like accelerates the aging process. Like a lot of things, similar effects happen, but it's like, 5-10 times more faster. And so with that, she's looking at, okay, well, maybe we can harness the power of actually being in relationship to gravity to kind of almost like reverse aging or slow down aging, or put our bodies more of a place of continual homeostasis, equipoise, balance, all that stuff. Is there something to that?
I would say in the grandest of large principles, absolutely there is.
Great.
Yeah. So you used that word homeostasis. If your body's adapted one way, I can't think of a system where it wouldn't reverse. If the drivers of the adaptation are normalized back once again. Yeah. But isn't this rehabilitation? It's regaining your health after you've had, say, a mobility problem. You've had an injury in your body, or a mental injury, or whatever, or you've been incarcerated, or whatever it happens to be. You've got to readapt that body back. And this also it plays a very large role in injury prevention as well, to bring your body back. Or, an athlete, as you know, it's a little bit of a specialty of ours to restore the careers of high performance athletes after they've been injured. And in our world, it's back injury. Yeah. And we're very much conscious of the dosage that we give them, the amount of rest. Don't get greedy with time and try and push them. There may be a lot of that pressure if they're a professional athlete, but we have got to mitigate all of that and allow adaptation and the tincture of time to optimize.
Do you have a sense of like some recipe for optimal spinal health as far as intensity of movement throughout the day? So that sedentary lifestyle throughout the whole day, just sitting, hunching over, staring at a computer, and then the block CrossFit class seems like that might be a little bit, I don't know, too much.
Well, it's the perfect storm.
Yeah, right. So what's the inverse of the perfect storm for the spine?
Well, I think you were asking me some time ago tips to age optimally.
Right.
And can I just back up for just a moment and create a principle that will help me formulate an answer to that question?
Yeah, please.
Okay, so the principle is this: as we've interviewed me in the past, and I usually start when you ask a question with
"It depends."
It depends, exactly. And the reason that I'm obliged to do that is that our bodies and the way that they move and work are governed by scientific principles. And as scientists, we probe the system to converge on an understanding. We call that the code. That's the code of how the body works. But every human is variable. You look a little different than me. Our body proportions are different. Our injury histories are different. Our genetic backgrounds are different. Genders are different, age, etc. So because of all of this variability, now we have to perform pattern recognition based on the code, but we also have to blend in our clinical experience. So now we can play jazz. So a good musician, but one who's still learning, they can play in an orchestra because you're following a score sheet. That's the code. But you need a really good musician who understands the physics of music, the nuances, so they can play in a jazz band and make it sound good. Do you know what I mean by that? You've got to be quite an accomplished musician to play good jazz. Right. So the great clinicians, the great coaches, the great movement artists are able to play jazz, but they're very, very accomplished. So if we can start with that principle, now I can answer your question about tips to age optimally. Yeah, so I have to start talking about the code. Now, one of the first principles in my world is look after your joints. So if you damage your joints, you're shortening your life. You're shortening the time over which you will be athletic, And it's so much fun. Go sit in the orthopedic surgeon's office and see who's in the waiting room, and that will convince you that blowing your body apart in the gym with extreme training. Look at me. I've had hip replacement, all kinds of, because when I was younger, I trained far too heavy. And had my share of injury and whatnot. So that's part of the code. But when we expand the code, the next part is look after your plumbing. Now, you do that by eating well. And if you follow Dan John, he says, eat like an adult. That's a pretty good simplification of the code. And moderate aerobic activity to keep the plumbing clean and open. And also train with a few more short, intense intervals. This is all good and governed by the code of keeping your plumbing healthy. Now, look after your electrical. And what I mean by that is not too much aerobic activity. So when you follow long-distance runners, for example, who've committed to really long distances for a lot of years, and then you look, their plumbing is wonderful, but what they're dropping dead with is electrical issues. The sinus node is worn out in their heart. In other words, that's an electrical flaw, and they need a pacemaker and all these kinds of things. So sedentary people, they fail with poor plumbing, and the aerobic fanatics tend to wear out their electrical side. So these are all concepts based on the code. But if I was to talk a little bit of jazz now on top of that code, and we look at different people in the population, let's look at successful people. There was an old firefighter who was a colleague of mine, and his goal all the time that he was working was to be the fittest 80-year-old ever. Now, if I said to you, do you want to win CrossFit tomorrow or be the best 80-year-old that you can be, you wouldn't probably do CrossFit. You would do something else.
Right.
But, I get it. It's a sport, so fair enough. But nonetheless, here would be a wisdom and how he played jazz. So when he retired, there's 7 days in a week. 2 days a week, he would strength train. 2 days a week, he would do mobility, or as he said, I work on the things that are a bit stuck. 2 days a week, he did something different. Now, they were usually a little more aerobic and a little more longer duration. He would go for a bike ride. He'd go for a long swim, or, do you know what I mean? A hike through the woods or something like that. And then on the seventh day, he rested. Now, all the time, he would respect biology and eat like an adult and that kind of thing. So there's a jazz with the background of the code that is moderate, logical, and very justifiable. Now, does it work for me? As you know, I'm retired and in my 60s. I am not. My life doesn't allow that much freedom that I can do all of those things. But every day, what works for me is I do a little bit of core work. Obviously, I have to, and I do a tiny bit of mobility on my injuries and things that need to be unglued a little bit every day. And I also try and do a little bit of I do 3 interval walks a day if I'm able to. And I go outside and I make sure I work with my hands doing some heavy labor. And I might be splitting firewood, or today I was working on a truck and on my wife's truck. And, there you go. So at the end of the day, I will not allow myself to have a beer, in other words, until I've satisfied those physicalities of moderation and adhering to the code. By the way, if I can just say one other thing, yeah. I think I have less pain now, and I'm more physically able than I was in my last decade as a professor at the university.
Why is that?
I'm not a slave to the desk.
Right.
I have been able to get a little bit more strategically stronger and strategically mobile. And the pain, I have no pain in my body now, unless I'm really stupid, really pushing things. But I have a funny story to tell you if you're interested.
Yeah, hit me.
I had my right hip replaced about 4 years ago, and I've had terrible bone pain down my leg ever since. I couldn't walk up 2 flights of stairs without getting bone pain. So as you know, with total hip replacement, they drive a titanium stem down your femur, down about the top third of your femur. And right at the end, I had tip stresses that would go all the way down to my knee.
Wow.
And, I had some people say, well, try vitamin E for the bone, because the root of the cause is the elastic modulus of the bone is not equal to the elastic modulus of the metal. And so you get stresses as one is moving with micro movements around the other. Well, I tried a little regimen of that. That didn't do a darn thing. And I had people saying, well, do these stretches. And then, if you can believe this, one guy even said, oh, you're catastrophizing your pain. It's in my head. And I thought, oh, you bastard, you never assessed me. You have no idea. And all you can do is default to blaming me for my pain. And I'm the wrong guy to do that to. But anyway, pain, there's a reason for pain always. And I get it. It might be emotional, but there's almost always a mechanical trigger. And then it's the trigger that's modulated by emotions and whatnot.
Can I say something to that really quick?
Yes.
Is there a separation between the emotional and the mechanics? Because anytime you experience an emotion, your mechanics shift.
Thank you. Fabulous. Can we get right back on that as soon as I'm done this?
Yes, absolutely.
Yes. Yeah. So if I can just finish off this story. So I met a fellow, and we get, here at BackFit Pro, I now have the clinic in my home. And we get different people coming by saying they offer devices and training machines and all this kind of stuff. Would you like to put this into BackFit Pro? Try it with your patients, because they just want that product to have visibility in our clinic when people of import come by. And anyway, so this was a pulsed magnetic therapy machine. Now, I don't know if you're familiar with how MRI works. Are you somewhat? You go into a big magnetic coil, and that coil has a current that goes through it that creates a magnetic field, and the hydrogen ions in your body, like H2O, the water, orientates its spin axis to the magnet. And then when you release the magnet, it goes back to its normal spin sequence, but it vibrates. And there's a resonance there, so it's called magnetic resonance imaging. And there are sensors that sense this resonance, and they build a 3D picture of it. So that's basically what MR is. Well, pulsed magnetic therapy is exactly the same thing. You go into this ring, and it creates a magnetic field. And it was invented by Nikola Tesla. And Tesla obviously is a name that's becoming back again. And he put himself in a big coil. This was over 100 years ago, because he said it was very healthy to do, which I can't comment on that. But
Right.
Nonetheless, this fella brought this unit by. And he said, would you like it? And I said, no, I have enough. So he says, well, just try. He said, let me leave it here. And I told him, well, I do have this femur pain. Now, you realize I'm a scientist and a skeptic and a clinician. I'm a hard guy to fool. I tried 3 sessions with it of half an hour. My bone pain went. I didn't desensitize and go away slowly. It's not as though I could walk up 4 flights of stairs with no pain and then 10 flights of stairs. The pain just went.
Wow.
So now, having said that, I had stem cell therapy on something else at the same time, but it was into a joint on the other side of my body. Is it possible it could have left that joint and migrated over to my bone on the other side? Yes, it's possible. Is it likely? No, it's not likely. So I do have a possibility of an alternate explanation. Well, with that, my wife, who you may or may not know, was a very competitive rower. She rowed for Canada in the 80s, and then she got back to masters rowing a few years ago. Anyway, she was supposed to have a knee replacement this past winter. She started on this unit, and we'll just get to the point here. She came back from the World Masters Championships in Sarasota, Florida. There were 49 countries. She came home with a gold medal. So this was after we were wondering whether, we were discussing, she really needs a knee replacement. And has it changed the appearance of them on MRI? No, it hasn't. But the pain is not there. And she walks without a limp and that kind of thing, which is normalizing of itself if you can take a limp away. Yeah. But there's an interesting story. Do you want to talk about the separation of pain and the mechanical triggers and the emotions?
I do. That was pulsed electromagnetic frequencies, like PEMF. Is that what you're referring to? Or different than that?
Pulsed magnetic therapy.
So PEMF is something that's becoming quite popular.
Yeah. I think that's what they call it. Okay. I'm not entirely sure. We'll have to look that up. But
so PMF, you like lie on a mat usually, or you kind of wrap it around you?
Yeah, no. Okay, the mat I'm very skeptical of. This is this is a coil that actually goes around you. You put the coil around you,
and so it's not contacting you.
Oh, it is wherever you're laying in the coil, but it is a true Tesla coil. The mats. The coils go around inside the mats. You need the hoop to go around you to have the true Tesla coil effect.
Okay, I gotta check that out because I've done a lot of PEMF where they'll like wrap the mat thing like around your leg,
I get it,
foot or whatever, and it kind of like zaps you. Dun, dun, dun.
Yeah. No,
different than that. Okay.
No, this is not to stimulate any muscle or anything like that. If you go to centurion-systems.com and awesome. Then you look under their easy system. They have those mats for horses and all that kind of stuff for racehorses, but the easy system is a coil. So anyway, I've tried that now with some masters rowers on knees and hips, and most people are finding relief. Right. Now, I've also tried it on some back pain patients where we measured the pain was coming from the bone, from the vertebra themselves, and we haven't had any success at all. Okay. So certainly for extremity joint pain, we're having some success, but none at all for the spine, at least thus far. Okay. So that's that. But I just did a podcast a few days ago where that's exactly what we were discussing, how they asked me, what about what we've heard about as pain science, the neuroscientists who are saying, well, the pain really is a process of the brain interpreting threat and all this sort of stuff. Right. And but as a spine person, we almost always measure there's a problem with the spine tissue and the brain has to interpret that pain. And of course, with the emotions of it all, that magnifies or reduces the pain. I get all of that, but you still have to have an original back pain trigger in the first place to allow the brain to modulate that. But the important thing is, how do you treat it? And there are some clinicians who think, don't treat the back, don't tell the person how to move around their pain triggers, just give them cognitive behavioral therapy. And I've got too many patients coming to me who are really have great cognitive dissonance because someone told them things that they interpret the pain is in their head. And that does, it's a dismissal of that back pain the person is feeling. And it's almost a reverse psychology sometimes. But anyway, that's part of the argument that I presented there was there's this duality or separation between personality and psychology and mechanical pain. And I said, I don't think it's either or, and I don't quite see the separation. And the evidence I brought out was my colleague and good friend Bill Maris, who's a wonderful spine professor at Ohio State University. He did fabulous experiments a few years ago where he would first perform personality assessments on groups of workers. And these were real workers, by the way. And then he would pay graduate students to act as supervisors, and they would come in and berate the workers, really get into them, calling them names and stressing them, in other words. Well, it was so interesting because then he was measuring the musculoskeletal loads after they were mentally stressed. Mm-hmm. The people who had very timid personalities shrunk back, they elevated their shoulders, they crushed their necks and their backs by using their trapezius and their back muscles. In other words, they loaded their bodies. So the emotions were going right into much more joint loads. The more, now there's a name for the personality and I can't remember, but the more confident personality, the more overt personality, they just said, to hell with you. And they kept on working and it didn't go into their body. In other words, their biomechanical load didn't change. So this was all wonderful evidence to show that it's not one or the other. And it depends on some people, it kind of is, but there's other people where it kind of isn't. Yeah. And that stress really does manifest as higher joint loads. And there are also personalities that when they get pain and higher joint loads, they're calling the doctor because, I hate to say this, but they farted when, there's something, they're off to the doctor. Right. This hypochondriac type of personality as well. So anyway,
well,
it's so interesting.
That's like, the rich get richer and the poor get poorer. If you can find yourself in really good structural, emotional alignment, they're the same thing, then things roll off of you, and then you can be exposed to any type of athletic event or emotional event, catastrophe, whatever it is, but it's like it moves through you and out of you. As soon as you have collapse or break at any level, then you become sticky.
Yes, that's a beautiful way to say that.
Yeah. So I something that I'm really enamored with, and we can wrap up. But what time do you got to be rolling out of here? We started a little bit late.
I'm retired. I don't have to go anywhere.
All right, good. Okay, good, because I like this conversation. So something that I'm really interested in promoting, cheerleading, is encouraging people to spend more time on the ground. So I wonder, what are your thoughts of, like, throughout, you said the desk was something that was pretty rough on you. What if you were in, cross-legged position and 990 position and straddle position, and then laying on your belly and then getting up and standing, sitting back down repeatedly throughout the day? Do you think that would be helpful for desk people?
What's the answer?
I mean, for me, it's absolutely 2,000,000% yes, but I'm asking you.
Well, the answer is it depends.
Oh, come on, it's yes.
Yeah, no,
I agree that it depends, actually, but yeah.
Well, I went to Korea, and it's really difficult to go to Korea and find a restaurant with chairs.
Right.
So you have to sit on the floor.
Yeah.
I couldn't do it.
So it depends on the mechanics of your sitting, and you need a lot of support. You need a lot of bolsters, pillows, cushions. Like,
yes,
that's the independence.
I do. The average Korean did not.
Right.
And in fact, I was quite made fun of. So they would bring out a little bucket or a little potty that I would have to sit on, and even then I was screaming in pain because. Do you know where the highest rate? Let's go through Caucasian Europe and let's just look at that gene pool. Have you heard me tell this story before?
I've read it, heard it.
Sure. Okay. Yeah. So the Celtic hip, the gene pool of the Celts, which is Normandy, France, small section of Spain, Scotland, and Ireland, have the highest rate of FAI, femoral acetabular impingement. And the reason for it is they have very deep hip sockets. So when you measure their squat and power production, they don't have much power coming out of the hole, like the depth of the squat. So if you have that kind of architecture, it's people fail pulling the load off the ground if they're doing a deadlift. But when the load passes the knee, that type of architecture hits second gear, and they just fly through the top half and they don't fail through lockout. Now, does every Celt have that kind of hip? No. All I'm giving you is an average of that gene pool with a great amount of variability around it. Now, let's take the polar opposite of that, which is a shallow hip socket. Do you know where the highest rate of, hip dysplasia? So there's an orthopedic disease associated with having a very shallow hip, where the ball of the hip falls out of the socket. Well, it happens to be Poland. So Poland has genetically, on average, a very shallow hip socket. But when you measure those kinds of hips in the deep squat, they have tremendous power out of the hole at the bottom, and they tend to fail more at the top. Well, interestingly enough, we just identified where the Olympic lifters come from, or the very deep squatters. And it's the same with the Ukraine and Bulgaria and places like that, which is, anyway. So my point is, the Korean population have a very shallow anterior rim on the acetabulum, as do the Japanese as well. So when you look at the Japanese martial arts, they take full advantage of all of this. And the stories I could tell of other gene pools adopting some of the Japanese martial art techniques. I know of some groups of them that are basically Europeans. Every single one of them has hip replacement. None of the Japanese masters do. So again, it's an architectural or an anatomical predisposition. So when you say absolutely, and I say, well, hold on, it depends. I've already had hip replacement, and I still can't get down into sitting on the floor comfortably, but nor could I ever in my adult life. So I can't live on the floor.
But I'm saying bolster your stuff up. I'm saying just give yourself the opportunity to get your hips below 90 degrees. So if for you the best you have is 90 degrees, then that's fine. It's just slowly starting to kind of explore your boundaries with hip function and ankle mobility. And then, for the least, like stacking your spine. So finding the front edge of the sit bones and being able to actually find alignment continually is what I'm saying.
I have no argument against that.
Yeah. And then from there, so it's like cultures, for example, that sleep on the ground, that it forces them to have to go through that full range of motion. Like, okay, I'm continually learning to get up and down off of the ground, which means then fall risk that's off the table for elderly. What do you think?
I agree 100% on that one. So when we were talking about how to age optimally, arresting a fall, balance training, ballroom dance, learning to get your foot out in front of you to arrest a stumble, these are all skills that will help you to live longer. They probably don't matter as much when you're 20. Other things matter more. But when you're older, the biggest risk for them will be falling, or the inability to arrest a fall, really.
Yeah. So what I'm suggesting is, while you have that ability, and it's like one of those things where you just don't think about it like any investment, you're investing now, you don't get the reward now, but it's like, I think in 50 years, it's going to be relevant. It's going to be really worth something. I'm saying for people that are 20, 30, 40, whatever, spending more time closer to the earth forces you to go through that full range of motion. And then when you are 80, 90, 100, 110, whatever, it's like you've neurologically wired that so deeply that you can't let it go. You know what I'm saying? Not you can't let it go, but it doesn't go.
Yes, I know of some fabulous athletes though, and I've been around long enough that I've followed them, and they I don't know if they were able to preserve that sense of balance any better or worse than anyone else. I know myself, today I found myself almost falling a couple of times carrying heavy tools and car jacks and things like that, getting them downstairs. And so, I thought to myself today, boy, I better get back on to humble myself back to balance training and whatnot, because I know how to fall. I've been in combative sports, that I do know. And but I can see how people who were formerly very adept at it lose that ability to arrest falls and roll and that kind of thing. So anyway, I guess what I'm saying is it's never too never too late to learn that. What's the transfer of it through the ages? I don't know about that yet.
Yeah, I don't know that there's been like enough proper, other than just seeing cultures that continually do that, and their instances of hip disease or falls is like very low. So that seems like a big deal, but I don't know that there's like a specific study on the effect of that and the correlation throughout old age. But my sense is if you're continually practicing getting up and down from the ground, you're wiring that pattern. So every time you do that, it's like a repetition. So every time you get all the way down, all the way up, it's like that distance gets shorter and shorter because you become more comfortable with it. But if you're always balancing standing up, then taking a fall, there's a big distance between you and the ground, is what that's my thought. That's what I'm investing in.
Well, that makes good logic to me. Yes.
Yeah. So the other thing I wanted to get into, and then we can wrap up quite soon, is the value. People become obsessed with the value of squat. You squat, and then it's like, I think that there's another, and we've already talked about this actually, but huge value to the whole like contralateral movement and walking and lunging, and because a squat is kind of like, if you can squat 1,100 pounds, like that won't serve you in too many situations nearly as much as being have like full range of motion in walking, running, lunging. Like squatting can become like a mutation, I think, as well.
Well, it makes you very easy to kill.
Explain. That's great. I love that.
Well, say you're a heavy squatter.
Yeah.
Say you can squat 800 pounds.
Right.
Are you going to be very buoyant in the water?
Right. Exactly. It's like, what are we doing?
You're not going to swim very well. Do you think you're going to be able to run? If you can squat 1,000 pounds, what do you think your ability is to run away from a wildfire in California?
Yeah, that's my curiosity.
You won't run very fast, and you won't run for very long.
Right.
So no, if we're talking heavy squats, you're now becoming a specialist, and you become much more easier to kill.
Right.
But if you get into a car accident, I can also name some terrific strength athletes who just walk away from car wrecks because basically their body has been adapted to iron. Yeah. And people don't realize that strength equals stiffness. And when they activate those muscles, they become so stiff. That's an armor around their body. And it's a tremendous protector against high energy impact. But if you want to did you want to talk about walking?
Please. Yeah.
Well, I mean, as you know, walking is non-negotiable for our back pain patients. Think and how the heck did squatting become so dominant? I think it's the internet more than anything,
right?
And trainers who they have a squat bar and a squat rack, and it becomes a tool for them, but they may not be that creative. So they think squats are the only ways to develop. But walk backwards up a hill and tell me how your quadriceps are burning. It's very humbling to experience that. But nonetheless, think of every exercise that you do in a weight room. They're almost always done either sitting or standing on 2 feet. It might be a squat, it might be a deadlift or bench press or some of the bodybuilding exercises. What they're building is sagittal plane strength. Think of what you need to walk. You need frontal plane strength. So as if you plant your right leg, that's your stance leg, and you swing with your left leg, if you don't hold up your pelvis flat with quadratus lumborum and the obliques and latissimus dorsi on the other side, then the pelvis falls and the spine bends and you lose your ability to bear a load. So the only time that you really challenge the frontal plane strength of your body, well, yes, you could do side planks, I suppose. But if you're standing, you have to walk. You have to carry things. So I think in modern gyms, the way they're set up, and people who get in their car, go to work, sit for 8 hours, get in their car, go to the gym, go home, most of the time they're frontal plane strength and stiffness deficit. So the beginning of those progressions always start with walking. Now, if you don't think walking is a good core activity, I suggest you go work with a child who has a paralyzed quadratus lumborum. So they've got some neurological disorder where they can't activate very well one quadratus lumborum, and then watch them walk. And you'll see, say it's their left QL, if they have left leg stance, they can swing their right. But when they have right leg stance, they can't swing their left because the whole pelvis falls down on that side. So you've got to have a fit, stiff, appropriately stiffened core to even walk. And as you know, the core is the mother of all proximal stiffness. And because we live in this skeletal linkage, I can't even wiggle my finger if I don't stiffen my wrist. In order to wiggle my wrist, I had to stiffen my elbow. And it all comes back to the core. So I can't sprint, run, lunge, walk, or do anything without that proximal stiffness through the core. So it all begins with walking, and then loaded walking, which would be with implements like a suitcase, or which is just a dumbbell on one side, or a farmer's walk, or a bottoms up kettlebell carry, or something like that. Yeah. But you won't be much of an athlete without that ability. But it's interesting when you measure some athletes how out of balance their core strength is, and they're usually frontal plane deficit.
Yeah. In relation to like core strength and intra-abdominal pressure and all these things, you didn't say that word, but I'm curious if incontinence and so the adult diaper industry is said to exceed the baby diaper industry by like 2000 soon. I think it's like the next few years. Maybe it's already happened. So people are adults are peeing themselves. And so I think if we were squatting functionally, we actually, and the environment that we were adapting to wasn't folding us into this hunched over position all day, I think that we would probably have more support around our pelvic floor muscles. Do you have any thoughts on that?
I am not, I really don't have much expertise in the pelvic floor. All I can really comment on is people who, I know they'll be critical of some of the things I do, and they say, this is going to cause incontinence. And I said, well, I've been seeing patients for 30 years. I can't really recall a patient who's prolapsed their rectum or their vagina or their urethra or all of these other things that people are accusing us of possibly creating.
Which part? What part would people be accusational about?
Well, they might say, you're stiffening the core with those exercises. Aren't the women going to become incontinent? And I said, well, they may. I believe it or not, I've never, ever run into that. Now, I have had women as patients, and I will ask them, do you have any incontinence? Or in the assessment interview, they will say, I do have issues with incontinence. And we will then work a strategy to deal with that. It's very rare, but I'll say, all right, then we will consciously do a pelvic floor I don't want to call it an exercise. That's what I'm struggling with right now, but a strategy that might involve the pelvic floor. So a kind of a Kegel or something like that.
Yeah.
But when you measure the great athletes, and then I have these pelvic floor people who have told the athlete, oh, drop your pelvic floor when you're running or squatting or something like that. And it is so inhibiting of performance that the performance isn't possible. So, there's, of course, there's the spectrum that we have to deal with, but I will say I am not the pelvic floor expert, and I don't really run into that issue.
Awesome, man. We gotta wrap up. Is there any kind of standout points, takeaway things you'd be good to mention before closing up?
Well, what have you been doing? I'm just looking at that shirt you're wearing, and I've never seen you so fit looking.
Oh, good. I think I'm just always wearing like a sweatshirt when I talk to you. What do I do? So my house, so for example, something that I do as far as like fitness related stuff is I'm really enamored by one, like dance, martial arts, things like that. I do like acrobatic things. I pick people up. So I do like acro yoga. You can see on my Instagram, I do a bunch of weird stuff. And then I'm really into temperature regulation as a means of fitness. So more like passive fitness. So I have a freezer sitting here like 5 feet away from us, filled up with water. So I'll go and freeze for 5 minutes or so. Then I have an infrared sauna right beside that. I'll get it really hot. I do hot yoga regularly. So I just like the idea of compounding variables. And then I also spend literally most of my day on the floor. So my whole day looks a lot like yoga is kind of what my focus is.
Wow, you're a monster for punishment.
No, it's not punishment. It feels good.
No, man, I'd never had so much pain when I was at Mel Sif's training facility, which was based very much on the Russian athletic training programs. And, we swam in ice water, and then we got into very hot contrast baths. But boy, getting out of that ice water after a swim, it was so painful.
It becomes addictive.
Yeah. Well, here at BackFit Pro, I emulated some of that. We have a very hot sauna, and then ice cold contrast showers. It's the best thing that we can get at least close to that. Yeah. And I'll do maybe 2 rounds of moderate temperature because I'm a wimp. And so I'll do that fine. It makes the beer taste a bit better at the end.
Right.
But,
my big thing, and this is what the whole book is about really, is changing. Like you can see behind me, I have like a yoga swing hanging in my living room. I have instruments all over my living room. I have, windows around, and painting, which is, there's studies that show that helps increase your pain or decrease your pain sensitivity, helps people get out of hospital sooner. And it's just like, if you can make subtle environmental shifts that are always feeding back into your physiology, then I think that, life just gets a lot easier. So I'm just looking at environmental.
I absolutely agree with all that.
Yeah. So
yeah.
There you go.
Oh, yeah, for sure. No, you're looking good. That's the only thing that I can think of that's half interesting.
Yeah, good, perfect. I appreciate that. That's good. All right, how do people learn more about your stuff? I already blow smoke up your butt every time we do this, but you've been like a huge inspiration. You've been a huge inspiration for me. I've read all your books, and I've listened to all your podcasts at this point. Really appreciate you, man. How do people learn more about your stuff?
Well, our website, thanks for that, is BackFit Pro, just like it sounds, backfitpro.com. And there are my books for the lay public who are unnecessarily and unneedlessly suffering with their back pain. 95% of people who've been told they need spine surgery after following that book have been able to avoid it. So that statistic, we've done follow-up that I can stand by that. And then my other books are for, Gift of Injury is for the strength athlete who's recovering from back injury. Ultimate Back Fitness and Performance is more for other athletes to regain their mojo. And then my heavy clinical textbook is for doctors. That's low back disorders, and it's not very much fun to read, but it's a very heavy book that describes the various back pain mechanisms and then what to do to decrease the risk of them occurring and how to treat them if they have occurred. So that's available there. We've got some pneumatic back supports and that kind of thing to take away the back pain triggers when you sleep and sit. But other than that, that's about the width of our being.
Love it, man. All right. Well, thank you so much, man. I appreciate it. I will, in relation to the book stuff, I'm going to have just sections, kind of little sections devoted to each person that I think is radical, being you being one of them, and then just have like some bullet points of what they refer to.
All right. If you want me to, in fact, I'd appreciate if you would.
I'll send them to you. And
send it to me first, and then you can keep us both out of jail.
Yeah, that's the way.
Just to make sure the quotes are reasonably accurate. Right. I don't want any editorial control. Absolutely not. But
no, I get it.
One word here and there can keep us both out of a lot of hot water.
Yeah, and it's super simple. It'll be probably 4 or 5 simple bullet points. I just want to have your voice and Kelly's voice and all the different folks' voice in there. It's just like, this is, it's not just coming out of me and Phil White's brain. This is like, it's more of a tribal type thing. So that's what we're saying.
Yeah. Oh, well, fabulous. I'm just trying to think of hooks for the book for you. Really, if let's go back to the guy who squats heavy, and I said he'll be easier to kill.
Yeah.
The key to survival is your ability to adapt, and that's a large part of so maybe the book could be called "Be Harder to Kill."
Well, the books, everything's, so it's already sold. Like my publishers and all that stuff. Like, so the name is called The Align Method. The subtitle, we're still working on it. It's going to be something along the lines of like, it's not going to be 5 easy steps, but 5 steps will be involved in it, but it's going to be much more than 5 steps. And because as I already know, you went through like the whole like publishing world of how have something that's like tangible, something people will hang on to. So there is a 5-step thing within the 5. I'd be curious your perspective, actually. 5 things that I think everybody should be doing is spending more time on the floor, walking, just like, and with walking, it's like choosing to walk or rollerblade or skateboard or something instead of driving your car all the time.
Get it. It's ambulate.
Yeah, ambulate. Exactly. So get like a pull-up bar, which I have hanging, 3 feet from my this spot here on the doorway. So just spend time hanging each day. Hinging at your hips, so cultivating a hip hinge, so like spinal neutrality and hinging at hips as you're doing like household activities as opposed to always hunching over. I think that might have been all of them. What do you think? Do you hate them?
Well, yeah. And then, okay, so there's your code. And then the jazz on top of that. So if you've got a torn up rotator cuff, do partial hangs with TRX.
Of course. Oh, of course.
Something like that.
Yeah. No, I'm not saying. So my whole thing is first become diligently aware of where are your boundaries, and then respectfully sit right beside them.
Right.
And that's, you don't want to blow out the boundary. And that's what we see in competitive lifting environments like a CrossFit that we kind of like poo-pooed on. I think CrossFit has a lot of value as well. But that's what you'll see rampantly is people blowing through boundaries and everyone rooting them on, and it's like it fulfills certain things, but, biomechanically, sometimes it's really disastrous.
Exactly.
Yeah. So anyways, but yeah, what are your thoughts? Spending more time on the ground in general. So that'd be like maybe sleeping low or like squatting, just squatting more in general. I recommend people working from the ground if they can, using adequate bolsters and cushions and stuff.
Yeah. Well, this is the thing. We all write our books and then we follow those themes. So I'm very happy to be able to help you with yours. I've already done my best effort.
Yeah.
And my best effort was back mechanics. So I put the things in there that I think are important. So you do your thing now.
Okay.
And, I've already had my swack at it.
Yeah. All right, cool. All right, sweet.
Okay, always a
thank you.
pleasure, Aaron. One of
Thank
these
you.
days we'll meet in person.
I know, man. I can't wait.
Well, where are you located?
I'm in Santa Monica. I'm right up the street from Pavel. You mentioned
Yeah.
he's on
Okay.
Nelson.
Fabulous. Yeah.
Yeah. So next time, do you have any plans of coming out here?
I'm in Seattle in February, and then I've got to go down and do a little gig in Vegas. And I was thinking of coming through California.
Yeah. If you do, man, I'd be happy to. I don't know.
Do you know Pavel?
From seeing him, we train beside each other. We don't like.
Oh,
train
okay.
together
So
like
yeah,
that, but we're in the same spot a lot.
You don't go and drink pickle juice together or anything.
We don't drink pickle juice. Yeah, no, I haven't.
Okay.
We've talked several times, but yeah, we don't drink pickle juice together.
Yeah. Okay. Anyway, no, I as you know, he and I are good mates. He's
That's good.
Lovely fellow.
Yeah. My experience with him has been only positive.
Right. Okay. Good luck with all this.
Thank you,
I'll hear
sir.
from you when I see the manuscript.
Yeah, absolutely. All right. Thank you, brother.
All right.
Have a beautiful
Take
day.
care now.
Thank you all so much for tuning into that conversation. I hope you enjoyed it as much as I did. I am super excited to present to you guys the Align Method online program, which focuses on unwinding some of the deleterious effects of essentially staring into technology. So forward head posture, rolled forward shoulders, and just general collapsy postural patterns, and also gets into a movement guide and how to integrate better movement into your life. So you can check that out at alignpodcast.com/align method, ALIGN podcast.com/align method, or you can find it at the Instagram page, Align Podcast, in the bio. Thank you to the folks that have grabbed the Align band, heavy duty resistance band with a door anchor and a free video guide that goes with it. So you can actually just access the free video guide if you want, just to get resistance band exercise in general. It's at alignband.com, ALIGN band.com. All right. Thanks guys so much for tuning in. Appreciate you. Enjoy the rest of your day. Pow.